Hello, and welcome to the monthly Psychedelic Chat. I'm Wendy Marusic, one of the co-founders of Open Nurses, and we're happy to have you here. Tonight, we will be interviewing Anand Thomas. Anand Thomas is a Certified Registered Nurse Anesthetist and a board-certified Psychiatric mental health nurse practitioner with 27 years of diverse nursing experience. Her career spans roles in adult and pediatric community health, operating room nursing, and open heart intensive care. She holds a master's degree in anesthesia from Northeastern University and a PMHNP postmaster certification from the University of Massachusetts at Dartmouth. She is also a graduate of the California Institute of Integral Studies Certificate in Psychedelic Therapies and Research and the Ketamine Training Center. Anand is a psychedelic facilitator, musician, and humanist. As co-founder of Overground Med and Mandala KAP, Anand worked with a multidisciplinary team to create programs focused on treating burnout and fostering resilience in healthcare workers post-pandemic. Her passion for co-creating psychedelic therapeutic modalities that rekindle individual agency to foster self-actualization in practitioners and patients alike. It is my great pleasure to welcome Anand. And if you're tuning in live, please enter in the chat where you're tuning in from.
Hi, Wendy.
Hi. Thanks.
It's so nice to be here. Thank you so much for this invitation. It's very exciting.
Great to have you here. We've been trying for a while. Yeah, so exciting to get you here.
Yeah.
Yeah.
It's been quite a year. Thank you for your persistence. I think we'll talk about that a little bit later.
We will. Yeah. I first met you back in, I think it was 2022 at Reconsider. It was a psychedelic nursing gathering.
Right. And that was exciting to be. I think I met Sandy Sandberg there too, and Leah Mix. It was just an amazing. I know that was the Bridges retreat. I met Leah Mix. There were so many amazing nurses doing such inspiring work at that gathering, yourself included.
Yeah.
So it's nice to be here talking to you about what nurses bring to the table.
Yeah, looking forward to hearing more about you here. So we'll start out. Tell us about the trajectory of your nursing career, and then how did you get involved with psychedelics?
So I have a long and winding road through nursing. I started as an LPN in, like you said, in community health and community health centers. Then I worked med-surg as an LPN, and then I moved to the big city in a hospital there, and they had a program to train LPNs to work in the operating room as scrub nurses. And I jumped at the chance, and I fell in love. I love the operating room. I think it's the most exciting place in the hospital, if not the world. And I just felt right at home. And an anesthesiologist is actually the person who pulled me aside and said, "You should think about anesthesia." Shout out to Dr. Bastian, wherever you are. And I at the time, I think I really was curious. I had started my own self-help practice, and I was really intrigued about what anesthesia was entailing and the way it related to consciousness. So I went back to, got my BSN. I got my associates, then my BSN. Then I went to Northeastern for my anesthesia training. And they sent me to Rhode Island for my clinical residency, and I just fell in love with the state. So I've been here for 12 years as a nurse anesthetist, and during the pandemic, all along, we're really working philosophically on my own sense of self, being the child of an immigrant, place in the world, understanding how cultural context affect our view of ourselves, our view of our agency in the world. Always curious about that cross-cultural context. And then when the pandemic hit, I really went into a meditative practice, started studying Buddhism and looking at consciousness and how, with seeing all that death around me, during the pandemic, the only people intubating patients in the hospital were the anesthesia department. And so seeing all that suffering day in, day out really called me to look deeper into what is this experience of life?
Mm-hmm.
Why are we here? When we talk about the Vedantic masters talking about like, who am I? And having that meditative practice, I really got curious and deeper into my meditative practice and reading more books. And I read Michael Pollan's book about
How to Change Your Mind.
yeah.
Yeah. What a book that was.
Yeah. And that's why I found out about CIIS. And I said, I'm in. I am going to learn how to do this work. This is right up my alley. These are my people, and that is really the start of my experience as a facilitator, learning about the psychedelic practicing and how we're blending these different cultures together.
Mm-hmm. What year did you do the CIIS program?
Ooh, I'm always wondering, I have to count back how many years. I think it was the second year of the pandemic. So 21?
21, okay.
22.
Okay. So all the founders of Open Nurses, we all met at the CIIS CPTR program.
What year were you?
We were in 2017. That was the second year they did it.
Oh, geez.
And there were like 40 something of us in person in a classroom, right, in San Francisco. And now it's huge. Yeah.
Yeah, my class was the first Boston cohort.
Okay. Right. Yeah.
Yeah, it just was so lucky that we had this whole East Coast contingent, and really created community. We met so many amazing people at MGH, people who were in private practice, people who were from other parts of the world who were doing this work. It was a really powerful program. And that's where I met my team. We were all part of the same cohort. Elise Hoblitzel and Swana de Geisel and Meg Stripe and Guy Saperstein. And Aldo Doneri, who created Overground as an idea and got us involved and then passed the torch. So
Tell me about Overground. What is Overground?
Yeah. Overground, at the time during the pandemic, learning about psychedelics and how it can help people with resilience. Aldo had this idea that there was a reason people were leaving the field. There was the trauma of having to work in triage circumstances, and the magnitude of how many people were suffering, and then the witnessing of that suffering and the exhaustion and the moral injury that people were facing. At the time, no one was really doing anything to really address that in healthcare workers. And because we're licensed and we have a lot on the table, we can't always even go other places where there's legal options for psychedelic use, because medical boards and nursing boards can be very punitive, even if you're in a legal setting elsewhere, if it's not legal. So we knew that there was someone who needed to do something for healthcare providers in the U.S. We knew about Roots to Thrive, which is a Canadian program working with healthcare providers and psychedelics, and they have a lot more support from their government in their country. And we didn't really have that here. So we wanted to figure out, what could we do to provide a safe place for exploring the parts of us that get broken by working in healthcare, the parts of us that train, and how could we use a psychedelic framework to really address some of the apathy, the sense of moral injury of working in healthcare in a system that sometimes puts profit before the patient experience, and definitely before the clinician's experience. We wanted to have a safe place for practitioners to legally have these deep explorations of themselves. Okay. So he created this project and asked us to come on board. And then when he left the project, we met up with two other therapists from Massachusetts, and we really decided that since we were working with burnout, we didn't want to create another program that we would burn out of. So we decided to create something that was deeply values-based, deeply self-nourishing, and that where we could be sort of fed by what we were giving and bring our full selves to it, a lot of us in healthcare, we compartmentalize and keep our emotions to the side. This is one of the most fulfilling projects that I've ever done, because I'm able to be my full self. I'm able to be my loving self, care of other carers and other givers in that way.
Cool. So how does it work? How so you get healthcare workers that enroll in your program, and then
yes. So our program is open to physicians, nurses, therapists, PAs, pharmacists, anyone in healthcare educators. And there's a screening process. There is a medical clearance. And the program is a cohort-based program. So it's a group of different types of practitioners, really creating connection, community, and going through this prep experience and integration together. And we found that there's so much power in community. There's so much power in being witnessed by others who understand what you're going through.
Right.
As veterans groups understand, and first responders understand, that it's really powerful to have a community of your peers who know the struggles you're facing, to journey with you. There's something very powerful about being in community in that way.
Right. Cool. So you're journeying on ketamine, I'm guessing,
Yes, it's legal. So
right.
we use ketamine. And, as an anesthesia provider, I kind of was like, it's ketamine, right? So we use it every day. It's, and I didn't, until I did my training with ketamine, I had no idea the depth of work that could be done with ketamine. I was a skeptic for a while. And then when we did our program, there was so much depth to what I had access to working with my own story, with my own burnout, being able to rekindle that thing that had me say, I would like to serve others, and really create places of replenishment with integration and with practices that I put in my life that sustain me. And creating that with other healthcare providers is such a rewarding experience. And I know all of my team, feel the same way.
So are you still running these programs?
Yeah, we have
our cohort starting, if anyone's interested, or what?
Yeah, we have a cohort that's enrolling in it. We will start enrolling in May, and the cohort's being run in November of 2025. It's usually a pretty small group because we do intense work. It's very, the ratios are very low, and we really keep it tight and safe. That's our next cohort, and
will that be in Rhode Island or Massachusetts?
It's actually in Massachusetts, in Watertown, Massachusetts. Yeah.
Okay. And what would be the commitment if someone from another state wanted to come?
So the program it's encapsulated in a week. We know healthcare providers don't have a lot of free time to dedicate to these kind of, so it's truncated into one full weekend. So there's Zoom preparatory meeting, then there's 3 days of in-person work, and then there's a completion on Zoom the following week. And then there's monthly connection opportunities for support and resourcing as time goes on. But the main focus of the program is a 3-weekend program.
Okay. So, all right, 3 weekends or 3 days?
3 days.
3 days, okay.
Friday, Saturday, Sunday.
3 days. So if someone wanted to commit, they could fly in and come for 3 days and then
exactly
do the rest of the program online or.
Yeah. Absolutely.
All right. Well, that sounds exciting. I know we do get people reaching out to us, asking where they can get more training and such, or experience, right? Or they're curious, or they're burnt out nurses and want to try something new.
Absolutely, all the time, and it's very vulnerable for people to reach out. So we really encourage healthcare providers reach out to us.
Mm-hmm.
Because we have a nice community of people to be supportive. So.
Okay. And maybe we can link your, you have a website, I'm guessing. You can link that in the chat.
Overground Med. Over, because we, as healthcare providers, we can't do underground. So it's Overground.
Right. Overground Med.
.com.
Okay.
You can also reach us by Mandala KAP.com. It goes to the same website. So.
Okay. We will get that entered. All right. So Michael Pollan was your gateway to psychedelics that combined with the pandemic, right? Kind of looking for
Absolutely.
Yeah. And then yeah. So what do you think nurses bring to this work? So you did the CPTR program, and there's all different kinds of practitioners that are in that program. And then, but you're a nurse, and at the time you were a nurse anesthetist, right? So what's the difference? What do nurses bring?
So it's so perfect because, when I was reading about the CIIS program, and Janice Phelps wrote this paper about preparing psychedelic practitioners, she lists these qualities of psychedelic practitioners, and there's this concept of abiding presence.
Mm-hmm.
And the nursing scope of practice, it basically talks about how nurses, our function is to integrate the art and science of caring, focusing on protection, health promotion, and optimizing health, right? But the function, I think, of nurses is to alleviate suffering through this sense of compassionate presence. And that's just who we are, that we know how to hold presence for people going through difficult experiences. And I don't know anyone who, maybe because I know a lot of nurses and there's a lot of nurses in my family. I don't know anyone who hasn't been touched by a nurse. From giving birth to the dying process and everything in between the diagnosis and the treatment and the cure and gaining of health. Nurses are there through the whole process, guiding us, sometimes giving us tough love, like asking us to do things that are uncomfortable, but are for our own good. And I think nurses have that capacity to hold space in a caring and strong and steady and nurturing and encouraging way, non-judgmental.
Right.
I've taken care of all kinds of people who have done all kinds of things. And my job is not to judge what they've done or where they are or their choices in life. It's just to be there for them and to provide that care for them that they need. And I think nurses just have that. We understand physical touch in a way that I think we could teach others in other professions about safe and nurturing touch that is boundaried, well boundaried.
Right.
I just think nurses are like you said, you said it perfectly. We're the Swiss Army knife.
Swiss Army knife, right?
Of psychedelics. Like, we can do all of it. We can monitor physiology. We can, we can look at signs and symptoms. We can alert. We can hold space through whatever someone's going through. And I think it's really powerful that we are already prepared to do it. Learning the process of psychedelics is just what's necessary for nurses to really come into this experience. And I encourage nurses to find out more about this work, because I think we need to be here. I think that we bring the humanity, a lot of the humanity back to healthcare. A lot of what we do is the heart and soul of healthcare. And I think that we need to be involved in psychedelics so that we keep that humanity in psychedelics, and it doesn't become just another procedure, which is something that I'm really passionate about.
Yeah. So what advice would you have then for a nurse right now who's interested in psychedelics, what should they do? Yeah, maybe they're an RN or something. What? Yeah.
Finding a community is important. There are a lot of people doing this work or curious about this work or doing research. Many hospitals have programs, and you'd be surprised the kind of research that's going on. I think someone mentioned it before, either the NIH or
clinicaltrials.gov.
Yes, clinicaltrials.gov, and seeing
Right.
what's going on in your area.
So many things going on. Yeah, blows my mind every time I think I'm on top of this, and then you put in the word psilocybin, and you see all these other universities that are studying psilocybin too. Yeah.
Yes, and it's growing. The interest is growing, and they're like at Brown, we have programs in development at Yale, at Johns Hopkins, and MGH. There's a lot of opportunities for nurses to get involved, and they're not necessarily coming looking for us. You may not know what's going on, but they need our support. The researchers need our support. They need our involvement, our insight,
our humanity, right?
Our humanity,
our safety, right?
Absolutely. And our insight as because we are bridgers in all of healthcare, we are resources in healthcare. We're multidisciplinary. We work with everybody, and we respect everyone's wisdom and knowledge base. I think nurses are just the perfect addition to any research team.
Any team, yeah.
Absolutely.
Yeah. I find the creativity of nurses for how to figure out logistics, right? So think about, like, I was an oncology nurse for years, and it's like, all right, you have, some situation happens, and it's like, these are the tools I have. How do I fix this?
Yes.
Right? We've got some towels, we got some scissors, we got, what are you, we got 3 people, what are we going to do? And how you can just sort of figure out how to make things work safely and, ethically, and preserving dignity. And
absolutely.
Yeah. And we know that we're the ones who have to handle it. Kind of make the joke, something, when things get weird or messy, everyone's like, nurse, nurse,
exactly.
Right? Everyone else is running out of the room. They're like, nurse, help. Yeah.
Absolutely. It doesn't faze us,
And psychedelics are not necessarily right there. You don't know what's going to happen sometimes. And to have a nurse around, I think, is great.
Right. Yeah. And for the patient safety as well, to have the comfort knowing that someone can handle anything that comes up.
Right.
If there's bodily fluids, we got you.
We got it, right. And
we're fine.
And we're not pretending. We're not like, oh, it's fine. And when, because if someone's trying to reassure you when they're not sure themselves,
when they're not okay with it,
you can see right through that and make you somebody more, dysregulated. Yeah.
Absolutely.
So check out clinicaltrials.gov, see what's going on in your area related to psychedelics. What else do you think a nurse should do?
I think definitely start doing your own work. And I don't mean, go out and have experiences. You could start with breath work. You could start with meditative practice. Start to know yourself. Go to therapy, have an exploration of if you've had a difficult childhood, start looking into exploring your own consciousness through just meditative practice is enough. Question your own paradigms, understanding your value systems, your assumptions about yourself, what's possible for you. I think psychedelics really helps people to break out of their boxes, and meditation is a good way to do that as well. And so it doesn't necessarily have to be a psychedelic experience, but definitely self-inquiry is really important to being able to hold space for others who are in this inquiry, to understand what assumptions you're making about reality, about who you are and what other people are. It's very helpful to understand your paradigm, to do ego work and understand your identification with either your story, your suffering, your identity, your belongings, your hierarchical place, all these ideas about who are we and our attachment to that might cause suffering, is great to explore with a therapist or with groups who are skilled at holding space for that kind of inquiry. It's really helpful.
Right.
And then there's training programs, there's ketamine training programs. It's different in different states. There's different types of programs, and nurses qualify to take these trainings. So you can go as far as deep as you want, and there are safe ways for nurses to protect their licenses and have these experiences and have these explorations, which can be very healthy for our own individual growth, and also, which I think is really powerful, how we see ourselves within the healthcare climate, what we think we can do. It's really expanding when you look at what you think you can't do and who you think you are.
Right.
And being able to expand that,
Yeah, that's great. Which ketamine training did you do?
KTC.
KTC.
Wolfson.
Oh, with Phil Wilson. Okay. Yeah, I did the Prati training.
Oh, how was that? I heard.
Well, was amazing. Yeah, so they're based in Colorado, Psychedelic Research and Training Institute.
Yeah.
It was wonderful. They have a retreat center in Colorado, and you go for it's like 4 days.
Yes. Wasn't that started by a nurse? Wasn't a nurse founder an RN?
He's one of the. So Scott Shannon he's a psychiatrist. But yeah, we interviewed, if people want to go back in the archives, Chris Pateros.
Yes.
So she's an RN, and so she's one of the main people that help run, and helps run I did an end of life training with them as well. So they have an introductory ketamine training where you learn, you do sublingual and intramuscular and 4 days of coursework, kind of experiential stuff. But then they do an end of life training. So then there were more nurses than usual in that program, and it was just wonderful. To use sort of as you can almost use ketamine as like a death rehearsal, or people who have existential distress, fear of dying. You can take ketamine and sort of dissolve away for a little bit, and then reassemble, and the fear of death can be greatly lessened.
Yes.
So
that sounds exciting. That sounds
yes, I think they'll be doing one in the summer, maybe.
That one up on the screen.
Right. I think Andrew just had that one on there. But the end of life training, I think they're doing it just once next year, and probably in the summer.
And is the curriculum very different between the two trainings, the end of life versus the standard
it's
training?
A bit different. I think, if you don't have any ketamine experience, I would recommend doing the introductory one first, or you can do it somewhere else. Although they do make exceptions for people who are working already, like in hospice or end of life, if they want to just do that training, you can do that one. There's a difference. And then Mary Casamano, who was at Johns Hopkins for years doing the psilocybin trials with cancer patients. She was a lecturer there too for the course, because she has all the end of life experience.
Yeah, she's amazing.
So it was about end of life, not just about ketamine. It was about so So you've mentioned your licenses a little bit already. Do you ever worry about backlash from employers or licensing agencies? How do you protect your license?
Yeah, you never really know what the political where it's going to go. You're not really sure. I think the thing is to be safe and to make sure that you're within legal guidelines, and that you're within your scope of practice. I think that's really important for nurses, that we're working within our scope of practice. And I think I haven't had any real backlash. I think I've been surprised at how supportive everyone has been. You get the occasional jokes, and then you have people Yeah, CJ, I love Mary too. You have a lot of jokes, people who've had experiences like in college or,
Mm-hmm.
I did not have those experiences in college. I was one of those people who grew up in the Bronx in the middle of the drug war. Crack was whack, fried crack,
Right.
fried brain. I was terrified
Of
of
drugs, right? Any drugs, yeah.
of any drugs or even altered consciousness, like states of consciousness. So I'm one of those people who really needed a legal pathway. Like I was not,
Mm-hmm.
and then what you want about the racialization of the drug war, I was
Mm-hmm.
not going to put myself in the position to be targeted. I
Right.
had
It's,
a child of immigrants. I had no backup, so it was
mm-hmm.
important that I represent groups of people that, I want to represent well. I don't want to get in trouble. Um,
Right.
so this renaissance was just a beautiful thing for me to see happening. People are interested in it. And then,
Mm-hmm.
my mother sending me articles about psychedelics that she's
Right.
seen, people that at work that know I do this work are connecting me with other people who are interested in research. I was just so surprised at how supportive and how open-minded everyone that I talked about was, or
Mm-hmm.
people tell me experiences they'd had, um, in a way that was really touching and vulnerable.
Mm-hmm.
And I just love having these conversations with people about consciousness, about what it means to be human right now.
Mm-hmm. Right.
So that's just my wheelhouse. I'll talk about that all day long. So I really have great conversations about psychedelics with my colleagues, and so I feel lucky in that way.
Right. I guess we didn't touch on your other degree. So you went into anesthesia, and then you did that for, you said 12 years,
Well,
or
we're still doing it.
still doing it. So working as a nurse anesthetist, which
That's
is
right.
you're inducing all kinds of altered states, right?
Absolutely.
Yeah. And then you went back to school, and you just graduated recently, right, with your psychiatric nurse practitioner. So what made you do that? Yeah.
Well, uh, we were talking about imposter syndrome, and
Mm-hmm.
I felt if I was going to do this work, I needed to have credentials. So the first part of it was the FDA, all the FDA guidelines,
Mm-hmm.
you know, that were being proposed didn't mention RNs, and that was frustrating. So I knew all the
Mm-hmm.
RNs working palliative care, and there were no other APRNs on the list with PsycNP. And I knew I wanted to do research. I knew I wanted to work in hospitals, and I wanted to be part of generating the data to see, is this really helpful for
Mm-hmm.
me? And so I knew I needed to have a PsycNP because of the FDA guidelines for research required that, which
Mm.
was frustrating because I'm already APRN and I
Right. It's quite a degree you have already. Yeah. So.
it was one of those things, and not for nothing. I really wanted to understand psychiatry in this
Mm-hmm.
country. I wanted to understand the system itself, how we treat psychiatric illnesses, and what resources are available. How rude.
Right. Yeah.
So cute. Um, yeah, so I knew that I was going to have to get
Mm-hmm.
another degree. So I had
Right.
just done CIIS, and I was a CRNA, and I'd done CIIS, and I was like raring to go, and I was like, okay, let's get this started. And then it was like, I need another degree to
Right.
really do this work.
Right.
So I kind of begrudgingly went back to school. I said,
Mm-hmm.
okay, I'm inspired. I want to do research. I guess I'm going back to school. And that's what I did. I found
Mm-hmm.
a program. I had another CRNA in my cohort who was in a psych NP program. And so she encouraged me. She said, we can do it,
Right.
And so I did. And it was a great program. It was very challenging. I had some close family member who got sick during the program. It was a lot. But shout out to the people at UMass Dartmouth CAGS program. They were amazing and so supportive, and just amazing clinicians and wonderful people to learn from. Valerie Senni, yay. And just really, really powerful clinicians and showing really at that level what nurses can creating programs. You know, and Beverly Rich at Bradley Hospital. Listen, if you want to see what nurses can create, so this woman, she runs the NP education program at Bradley Hospital, and if there's a problem, she'll create a program for it and then nurture other nurses to run those programs. She just creates leadership by walking in the building. You know, I can't say enough good things about what she's doing at Bradley. And there are so many amazing NPs that I met along the way who are creating solutions. And I think in anesthesia, because we're kind of like in this OR bubble, and we don't work a lot with other NPs except for our PACU NPs and in passing in the hospital, I don't think we really get to see the impact that all nurses are making and creating solutions in healthcare. So it was really exciting to get that education about how much of an impact nurses can have at this level in creating solutions, creating research, creating data, and solving community-based problems with the resources of our institutions. So I was really grateful for that education.
That's great.
Even though I was begrudgingly doing it.
Right. Yeah, I did that as well.
What had you decide? What was the thing that made you decide to go back? And I guess I gotta get it.
I was just realizing it was like, I think with my skill set, even though there are plenty of ways you can do this while being an RN, you know, and I trained for 2 years in therapy through Hakomi, which is a somatic mindfulness psychotherapy.
Yeah.
I did that for 2 years after I did the CPTR program. The Midhoffers recommended, they're like, go learn how to sit with people. I was like, I'm already an RN, right? Okay, I have a PhD. It's in biology, not in, right? But they're like, go learn how to sit with people. Go do Hakomi. So I did that, and I learned how to sit with people, and it was incredible. And we did all our own work on each other and learned how to work with mindfulness as an altered state, and it was incredible. Really expanded my capacity. But then it was like, all right, I think I need that credential, you know, or like you're saying, and you know, I'm not officially a therapist, right? I can I can't, you know, bill insurance for therapy, even though I've had extensive therapy training. I think I want to be able to prescribe or, you know, or get the training to be able to really manage these, you know, different mental health conditions.
Absolutely.
So I said, all right, I'll do this. So yeah, so I did it during the pandemic. And yeah, it was good, but it was like another degree. We need another degree, and I was like, but if it makes sense, okay, I'll do it. You know, and it made sense, right? For you, it makes sense too. Like, do you feel a lot more qualified?
Absolutely, and I'm learning about therapeutic modalities, having a therapeutic license. That was really what I was there for. I really wanted to understand how to provide therapy, how to use different modalities to help people go through these processes when they weren't under the influence. I feel like psychedelics are this catalyst for what you're already doing, which is really powerful, but you need tools in your toolkit. You need to have different things that you can use. And as we look at the research and show that it doesn't matter what the modality is, it's really the connection between the therapist and the patient that really predicts positive outcomes. At the same time, you want to have some tools that you are comfortable working with. Just like in anesthesia, the best tool is the one you know how to use. You know, the one that you can use easily and troubleshoot a situation because you have facility with that skill set. So I think learning therapeutic modalities, and nurses can do that. You know, you can take a course in AEDP or in CBT. You can take these courses and understand these things, even if you're not billing insurance for therapy. I think it's important that we understand some of the ways, like parts work. I think is powerful for anyone working in this field.
Absolutely.
So definitely a therapeutic education is possible.
Yeah, I mean, I would highly recommend Hakomi as well if you can find it. It's it made me a better RN. I was able to really drop in and have conversations, or the little nuggets of, you know, I was dropping on patients really landed. You know, there's ways to get through people's defenses to make them feel seen, and form that connection.
Yeah.
So and you just sort of touched on that, but do you think nurses need advanced degrees or not? I mean, you have two of them, but do you...
My professor Janet Dewan always says it depends. I think it depends what you want to do.
Mm-hmm.
Do you want to prescribe as it looks right now? Do you want to be part of research teams? And do you want to work independently? You know, what do you want to do in this? Do you want to support other people doing this work? Do you want to be a facilitator? If you are willing to move to the areas like Oregon and Colorado, you could be a facilitator without getting another degree.
Right.
I know nurses who've given up their degrees, so their licenses, so they can do this work. So they're not held to the standards of nursing. They can be a coach, or you can be a coach as an RN. You know, there's a lot of ways to get involved. For me personally, I wanted the degree. I wanted the autonomy. I wanted the ability to create something. And to say and to direct the path. I think that's another thing in nursing. I think I encourage nurses to create programs, to get a couple people together and create something, even within your hospital. Create processes in your hospital, but I don't think you need to do another degree to do this kind of work, to sit for others.
Right.
There are many. The majority of people sitting for others in ketamine clinics are nurses.
Right.
We're in infusion clinics. It's the nurses. You know, we're there. I think beefing up your skills for your personal development should always be ongoing anyway.
Right.
You know, I'm always learning something. I'm always in a course. And I have to say that I feel I'm well resourced. I can do that. I have the benefit of being able to do that. Not everybody has that freedom, and there's other responsibilities, and there's a cost associated with a lot of it. But I do think that it's important to keep reading and keep developing.
Right.
So I don't think you really need to do a course. Bottom line, I don't think you need to do another course. But if
you want to do a degree, you could. But there are ways, right?
There are ways,
as you're saying, right? Ketamine clinics. Often it's the nurses doing the majority of things there. There are some nurses actually involved in research. So we did an interview with Heather Honstein, who was also at Reconsider with us, right?
Yes,
so she's working at, if you look back in the archives, she's at Sunstone, which is, so psychedelic cancer center.
Yes.
Research. Chris Pateros from Prati, the ketamine training group, she's also been a study therapist for end of life with psilocybin.
Right. Bruce Poulter.
Right. Yeah. Bruce Poulter. We got Annie Midhofer.
Right.
She's an RN. Yeah. So Karen Cooper. So there are ways to get involved in research. But if you want to design your own studies or maybe be the PI, that might be a little trickier. But yeah, it's an option. So are you currently? So you talked about Overground Med that you work with. Are you working with psychedelics outside of that? Are you giving ketamine to anyone outside of the OR, or just during those cohorts?
Just during those cohorts. Right now we're like in the beginning stages of a cancer survivorship program that we might be developing utilizing ketamine. And other than that, we're focusing on healthcare providers and supporting them with burnout and reigniting the passion for healthcare. So those are the two programs that I'm working on. And then I'm working on looking into what private practice looks like, what having my own business looks like, and exploring that.
Is Rhode Island a full practice state?
It's a full practice authority for.
Okay, wow. So yeah, you've got lots of
Not for
options.
CRNAs, but for PMHNPs.
PMHNP, okay.
Mhm.
Okay.
So that's the next step for me is developing my own private practice.
It's exciting.
It is. It's
yeah,
interesting.
this is
on the entrepreneur hat, taking another course on entrepreneur. At Cornell, I'm doing another course there to teach me how to, because you don't learn about the economics of healthcare.
No, I'm learning that now. Yeah, a bit working at a psychiatric clinic where we do Spravato, the ketamine, and we do TMS and other things. But I'm learning about billing codes and all kinds of things they don't teach you in school. Yeah. So those of you who are tuning in live, if you have any questions, you can type them into the chat and we'll get to them shortly. Just kind of one more thing, when you're, I know you've been involved in kind of advocating at the government level for different things. So like what kind of advocacy role do you see nurses taking? Maybe changing laws or policies, just public education, harm reduction. What can nurses do as advocates?
All of the above.
Yeah.
I think advocacy is really important. So growing up in New York, it's like government is so far away. It's so big, Albany. But here in Rhode Island, we know our representatives. We know our senators. Sometimes they know us. It's really easy to educate. It's really important for nurses to be the educators. We are trusted as educators for the public. And we have a very matter-of-fact way of saying things as it is. And in measured ways. I don't think that I think it's important to be measured about psychedelics. Psychedelics are not risk-free. It's not a magic bullet. It's not a cure-all. It's a process. And one of the things that I've found is our legislators know about some of this work, especially those who are connected to veterans. They know about PTSD. They understand how difficult it is. They know the crisis that we have. And I think it's important to educate them about the benefits and how to do this safely. And nurses have the opportunity to educate the public and our public servants about the benefits, the risks, how to keep people safe, and just the research in general. I think it's important. Advocacy is coalition building, working with other people to really have this safely provided to the public is really important. And nurses play an extremely important role in getting that education out.
Yeah, there was that survey out of Berkeley. Who would you want to educate you about psychedelics, or who would you trust to teach you about psychedelics? And it was nurses topped the list.
Wow.
Above doctors, above,
Interesting.
Yeah, because I think nurses know how to explain things, and maybe they're a bit more down to earth.
I think so.
Yeah.
And speaking to what someone might be experiencing.
Oh, I see we have a question here. So what perils do you see in mainstreaming of psychedelics?
So one of the things that I think is important to consider with psychedelics come from a long lineage of wisdom in indigenous practice. And one of the things that makes me nervous is removing the context, the community, the container of these experiences and making them into a medical procedure where you come, you get your treatment, and you leave. The opportunity that we have with psychedelics is to bring the humanity back into medicine in a way that supports not only the patient, but also the providers, and being able to create treatments that treat the whole person, that acknowledge the context of the culture that we're living in, and create safe environments for people to do deep explorations. So when we talk about mainstreaming psychedelics, I think it's important to have systems in place that keep people safe, that resource people, that there's enough preparation for these sometimes extremely destabilizing experiences, that there is enough resources into that we're not just saying this is scot-free, that we create the opportunity to safely and well.
Right. The searches for the preparation and integration get lost. People just show up for the ceremony, right? But then what? Yeah, and then they try to just go back into their life, and nobody. This has the context, right? You go talk to your friends and family. If they haven't had that experience, they don't know how to hold you. Yeah.
Exactly. And I think that if anyone has had a near-death experience, there's a lot that comes up in that. And a lot of psychedelic experiences can be like a near-death experience where you're separated from your ego and you're looking at who am I and what does this mean? And not having the support to process all that can be traumatic in of itself. So like those at the Zendo Project will tell you that it's really important to have that support when you're having a challenging experience. So I think it's really important that we create pathways that are not so expensive that people can't reach. And that's another thing that I worry about is the cost of medicalizing it completely. Where you can only go to a physician or a practitioner's office to get this treatment at this price level.
Right.
I'm hoping that insurance companies like Anthea will follow Anthea and Blue Cross Blue Shield of, I think, Alberta or somewhere in Canada. They approved some psychedelic treatments coverage. I'm hoping that insurance companies here follow suit so that it can be reimbursed and people can actually focus on doing this work well, safely, and affordably. And I think the biggest thing I worry about is equity. Those who can pay for it will always get it. And those who can't, they just don't have access. I think it's important that an equity conversation be had so that everyone can have access to good treatment, powerful, well-delivered care.
Right. Yeah, I agree. Oh, how can nurses contribute to increasing equity in the psychedelic space?
I think we like to talk about how we are cost effective.
Right. We are, right? At least we are cheaper than,
than other practitioners.
Yeah.
And the healthcare environment knows that. Healthcare, the healthcare establishment knows that we're a good deal. We do a lot, and we fill a lot of the gaps in the healthcare system. And I think that we should capitalize on that.
Right. And we get more time too, right? Like we can get hours with the patient versus like 15 minutes for another. Yeah.
Exactly. And doing it, like I think Andrew said somewhere, doing an 8-hour shift or a 12-hour shift of sitting for someone is not a big deal for a nurse. We do it every day.
Yeah. Only one patient? Sure. Exactly. No problem. Right. And I have a helper? Right.
What? I can go to the bathroom, really?
Right.
Yeah. So it's we're just a natural fit for it, and I think a cost-effective fit. So I really think the people who are involved in creating like the FDA should really hear that that this is a cost-effective way of providing this kind of care,
right?
And that we should not be left out of that. I was so shocked that so many nurses were left out of it. I'm like, do they even know healthcare? Like, we're gonna be there.
Right. Yeah.
You might as well include us in the planning.
Yeah, absolutely. So, right. Well, let's see. We do have our. Let's see if anyone else has any questions in the chat. But this is our our famous last question here. If you could go back and give your younger self a bit of advice, what would it be?
I think it would be to believe in the value that you provide. I can't tell you how many times I've heard nurses say, I'm just a nurse. And, if you work with me, there's a lecture coming after someone says that, because that's like, what do you mean, just a nurse?
Yeah, me too.
This hospital is designed for your services, for your care.
Right.
People don't come to the hospital, but for nursing care.
Mm-hmm.
I know it's important for us to value what we bring to healthcare, the value we provide, and the difference we make. We make the difference for so many people. And I think in my understanding of the medical hierarchy, I didn't really understand how much I could do and the difference I could make. And I would just say, start where you are. Right where you are, there are quality improvement projects you can do. There is information you can find. There are programs you can get involved with. There's advocacy. There's information. There are communities around you. Start where you are and believe in your value within this system and outside of it. I remember at Reconsider, we had this exercise where people are standing around in this circle representing the establishment.
Mm-hmm.
And they said, put yourself in that where you think you are. And I'm peering over someone's shoulder to see what's inside. They're standing there like this edifice. And I remember Steve Akpon sticks his leg in this, the group of people, because he's a bridge, right? He's bringing other people into the establishment. And then this guy gets up and runs outside and starts dancing on the bridge outside. And it blew my mind, because you can work outside of these systems. You don't have to try to wedge yourself or try to change the systems necessarily. It is helpful if we're trying to change systems from within, but we can create programs elsewhere. I know nurses in my community who are creating primary care practices that are differently modeled, that are more hands-on, that are more concierge type care, and equitable and profitable.
Right.
I think thinking outside the box is how nurses are going to help the system by bringing what we know into fruition, whether it's within a system or outside of it. Just starting where you are and believing in your vision and believing in your values. Our Overground program was created based on shared values. 4 people got together and said, these are our values. This is what we believe in, and this is what we want to create. And we did.
Right.
And we created it, and we're making a difference for people. And I think it's important that we remember that it's who we are. It's not our title, it's who we are. And that's outside of all of these structures. Your input is valuable. Your insight is valuable. What you have to offer is valuable. And we need you. So that's what I would say.
Right.
That we need you.
Yeah.
So come on.
Come on. Yeah, it's a large table. There's room for everyone. Yeah.
There's plenty of good room.
Right. So.
Yeah.
Oh, it's been such a pleasure talking with you.
Fun talking to you. I got to talk to you about your travel, because I'm a travel person too. I think travel is psychedelic, paradigm shifting. It's
it's all perspective shifting, right? When you see different ways of being, right? Whether internal or external, right?
Absolutely. Yeah. Thank you so much, Wendy. This was lovely.
Thank you. And this is your group here, Overground Med.
That's right.
There'll be what are the applications due by May?
There was where you can send us a message, fill out a contact form, and when we're starting to create our cohort for November, we'll be reaching people out to people in May.
Okay.
And we'll be talking at Cambridge Health Alliance about our program, their conference in March. And there's something else we're doing. But we'll be, if you go to Overground Med, you'll find out what we're up to. And find us on Facebook and Instagram. So please reach out.
Wonderful. All right.
Thank you.
Yeah, thank you. Remember, we all make a difference, right? Go nurses.
Go nurses. Every single one.
All right, everyone take care. Have a great month. We'll see you next time.
Bye.
Bye.
Oh, hey, Dan.